2024. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen in to find out how pharmacists and pharmacy students like me can help to improve population health, health equity, and patient care through advocacy and education. My name is Cassie Capezza, and I'm a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health alongside my professor and preceptor, Dr. Bratberg.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, the University of Rhode Island, nor Boston Medical Center.
Today we'll be talking about recovery from opioid use disorder. If you or someone you know is experiencing opioid use disorder or misuses opioids, call the Massachusetts Overdose Prevention Helpline at 1-800-972-0590. Available to anyone in North America. Stay tuned for part 2 of us being joined by our incredible guest, Stephen Murray. Please find part 1 of this discussion posted on January 16th. So you talked about how you were faced with these barriers which were stopping you from having a successful recovery. When thinking about after the intervention by your family, can you pinpoint one specific supportive component to your recovery, or was it more of like a holistic, like a system of support that was beneficial for your recovery?
I think what's interesting about my recovery, and this is something that I've struggled to talk to my family about, I've kind of like trickled this out to them a little bit, but like my recovery from an outside perspective looked really great. Like Steven went to rehab and he never had to go back again, and he never did drug, because that was the narrative that I put out, because the same thing that I used to keep people from finding out I was using drugs, the PR pitch, right? I use that also in recovery to prevent my family from being scared or disappointed or whatever about me, right? So I had times where I used in the time that I was counting as like abstinent sober time, right? I mean, I even celebrated a 10-year anniversary 2 years ago and had a party, but I had used drugs multiple times during that 10 years, mostly towards the beginning, right? And like it never got back to that point where it was chaotic. But I had points where I used again. After when I was living in New York City, like a year and a half in, my girlfriend broke up with me and I lost my job. And I was dumpster diving. I was like, had this dumpster diving business there. And I sold like $75,000 worth of stuff on eBay that I found in the New York City trash, right? Upper East Side. I was doing estates. I was following estates, finding silver, money, handbags, shoes. You know, people would have a pair of Louboutin. I'm like, I can spot a fake purse from like, I'm an expert at purses. But like people would buy like a real like Louis Vuitton purse, for example, and they get one little scratch on it and they throw it away. And like, okay, it's not worth several $1,000s anymore, but someone on eBay is going to buy that for $2,000 with the one scratch on it, right? So I was just reselling Louboutins, for example, red bottoms. You ever heard of red bottoms? Louboutins, really expensive shoes. People would get one scuff on the bottom from wearing them out one night, that messes up the red bottom, throw them out. I'd sell them for $500 the next day on eBay. So I was doing really well with that. Well, I used to find a lot of medication. And while I was employed and happy with the girlfriend, I was feeling strong and I would find opiates and be like, oh, throw those right back in, cool, good to go. After I had the breakup and the loss of job, and I was actually moving towards losing my apartment too again. So now here I am 2 years in recovery, about to lose everything again, right? From that perspective, I actually had to go move back in with my parents after this. One night I found opiates and I used them for one night. So did I tell anybody that I did? Did I restart my counter? Did it erase any of the progress I had made over the 18 months? No, I just kept, but I didn't tell the truth to the people who cared about me because I didn't want to worry them. Because in their mind, that one night of use, like I should have gone back to rehab in their mind. I didn't, but in their mind, they would have seen that as like a relapse and therefore a restart and going back. And so recovery, when it's based in abstinence only, can be really demoralizing for people, because day counting in and of itself is demoralizing if you feel like you always have to restart. And Jeff, you may have seen I tweet this sometimes, but like I like to use the idea of like a journey, right? Because recovery is often described as a journey. So if I was driving from New York to Florida, which I used to do a lot because I lived in Miami and my family was in New York, I drive from New York to Florida. If I got a flat tire while I was in Pennsylvania, what would I do? I would stop, I'd assess the damage, I'd fix the flat tire, and then I would continue on the journey. I wouldn't get like teleported back to New York and have to restart and lose the progress that I had made within that journey. I would take what I had learned and then keep going. But because recovery really focuses in a lot of, I mean, this is still true in treatment centers across the country, in 12-step programs, etc. Day counting is based on use. So I used to see people who would, when I was in AA, they would 45 days. I'd see them a few days later, 50 days, 70 days. I wouldn't see them for like 2 days. They'd come back one day. And I'd be like, they were only using for like 2, 3 days. And then they're like, oh, I don't want to do this anymore. And they come back, but they were back at one. And like,
It's like you fail a quiz, right?
yeah,
And then it's like like Cassie, you'll probably appreciate this, and you've been in college, so it's this idea of like you're arguing over 0.1% of one grade, like the big, yeah, she's smiling, right? I mean, the interesting thing is like you got like I love the idea of the journey and not day counting and not doing those things. So that's actually really important.
well, and it brings me to sort of the next part of this, which is like, why don't I consider myself to be in recovery anymore? Besides that, when I was diagnosed with like chronic fatigue, that was now 3 years in, I was prescribed Adderall again. And I was taking it as prescribed.
And these people knew your history.
Yes, knew my history.
You're being
Yeah,
fully transparent.
but I was like not functioning well, and I had a job at that point. It was like, okay, we need to help him sustain, right? So I was put on my psychiatrist put me back on Adderall. Every once in a while, I would sniff a bunch of Adderall and play Modern Warfare all night and on PS3, and like, but then I'd go to work the next day and I kept going and like never told anybody. I didn't tell anybody for you. Actually, I don't even know if I've ever publicly told that story, but like that, who cares, right? But like that was 3 years in to my day counting, so to speak, where I was publicly day counting for my family and friends and never told, never restarted, never read it, and I didn't take the sort of like psychological hit of restarting and having to go back to treatment. I just kind of like did drugs for a few days and then I was like, okay, I'm good. And I would go back to like normal, like my normal, right? And I like the question that Cassie asked is about what was the single thing that worked. And for me, it was actually ejecting from treatment. The one thing that worked for me, the worst I ever felt was after an AA meeting where people were talking about their drug use for an hour and their war stories and obsessing over it. Even now, like it's like I find it hard to believe that people think it's therapeutic to go in and talk about the thing that they're trying not to do. That part doesn't jive for me. The second thing was that I refused to be powerless over inanimate objects. The choice was always mine. The choice not to use was mine. The choice to use was mine. So the day that I did opiates, that was my choice. I said yes. After saying no dozens of times, dozens of nights before that when I found it, that was my decision to say no or to say yes. That when I used Adderall those couple times, that was my decision to say yes. And the decision to say no. And my daughter is prescribed Concerta now. So I'm making the decision every day to say no to myself, that I'm not going to take her Concerta. I mean, she's my daughter, right? I don't want to take, there's other reasons why I say no besides my own interests, right? It's because I'd be taking my daughter's medication, right? So I'm going to say no on her behalf, right? Because I care about her. If I said yes one day and took one, would that mess up 12 years of my life that I've taken back? I don't think so. But the dominant narrative would say yes.
Well, because
So,
the dominant narrative is, again, it's this irony of in recovery, in abstinence-based recovery, right? In day counting, I like that term. Day counting recovery is you're only one failed task from losing your job or
yep.
whatever, or you are
You're one drink away from going
one
back to
drink
where you
away,
were.
one white lie away from well, let's talk on the white, like one lie away from your relationship failing. It's like oh my gosh, we're all talking about journeys here. Your job, your personal life, your sleep schedule, like
It's so consequential,
yeah.
right? It's like if I viewed the thought of taking one of those pills that it's going to ruin my life, like it's almost like self-fulfilling. Like if I took that pill, I'd be like, well, throw it out the window, 12 years down the drain, screw everything I've done. Now I'm back to, I'm putting up air quotes. Now I'm back to being an addict. Like if I took one and I was like, oh, yeah, took one, that was a dumb mistake. I don't want to do that again, and just like let it go, it has no power, right? I
So
made one
it sounds
decision.
like you're what you're interested in, and I think that the one of the key outcomes of anyone listening is that it's about perception, right? Like
Right.
my brother used to tell me, perception is reality, and that helps me think. It's what I teach students too, is to be like, it's all about the audience, right? That's why I like to remind, hey, you're reminding the audience, everybody know what A is, or like, does everybody know what this abbreviation means? Because once you lose the audience, like, why are you even? Or I would tell Cassie's like, I'm feeling ill today. I'm like, stay home. Like, don't
Right.
work, because who wants to work when you're not on your game, right? Don't do that. Um, I mean, she's got a really interesting follow-up question, I think, on this topic.
Yeah, so you've experienced these perceptions from the public, media and professionals, all these perceptions they have of recovery. Do you feel that these perceptions changed over the years, particularly since COVID-19 started, with many people having to deal with isolation during the time period of COVID?
I think that in a lot of ways things are softening up a little bit. Like we're seeing harm reduction mainstreamed, which like is a good and bad thing, right? Like it muddies the message, the true message of like harm reduction, which is like anti-prohibition, and it's about the liberation of folks who use drugs, especially folks of color who've been so heavily criminalized by prohibition. Like that's the root message, right? And it's been sort of muddied that harm reduction is to reduce the harms of drugs. And I don't look at it that way. Like I look at it as like to reduce the harms that are caused by prohibition. And so I draw a distinction there. But I think that what we're seeing is the legalization of cannabis taking off, the legalization of shroom. Like so when you've heard the dominant narrative like my entire life, like weed is bad and it's illegal, and if you smoke the wacky tobacco, you're like one step away from being in jail, right? Like that was like the messaging when I was a child, and I'm not that old, right? To now it's like weed's just as cool as alcohol. Whatever, you want to smoke weed, smoke weed. Massachusetts, I could go to 10 dispensaries in like a 5 mile radius now. Like, but it takes a lot of the power away from it. It takes the allure away in a lot of ways. Like it's just now it's just another thing. So I think we're having some shifts. um I would love to see that shift extend with full legalization, because I think that if we pulled the criminalization element out of this, we could stabilize the drug supply so that it was safer. And when people, like, I used almost entirely from what I would consider to be a safe supply, and so the daily risk of death to me felt like a lot lower. And I used alone in isolation. I had a couple of bad experiences, which, I'm lucky to be alive, but those were isolated incidents really across the amount of drugs that I did. Like, I don't think I would have survived this drug supply. Not even for a month. Like the things that I did, and how ashamed and secretive I was about it. I don't think I could survive this drug supply. So um, I think that has, like, COVID-19, fentanyl, the drug supply changing, that has like necessitated a change in how we view these things. So it's like, it's kind of ironic because like it took even more death and destruction to like make people maybe realize, which is really depressing. So I don't think it's a good thing. But I do think that we are maybe slowly on a pathway to like understanding that criminalization has not been helpful. But then we see this backlash in places like Portland, or in Oregon, where like they're now going to maybe roll back decriminalization because there's been a conflation of decrim and overdose. Like these are, I could have a whole hour long talk on this, but there's always this like messaging. Like prohibition's a very strong machine. It's a machine that's been built by law enforcement. It's a machine that's been built in a lot of ways by the medical field. And so I think that there are good signs, and there are signs that like this could be a big machine to move, you know. Um,
Yeah,
I,
that's let's jump in to
yeah.
the next. I think this is a really good transition here.
So, in the call, you described how you knew how to treat situations because of your firsthand experiences prior to working as an EMT. Do you have any advice for other healthcare professionals like pharmacists, students like me, to demonstrate similar empathy and awareness?
Um, I mean, I think that like what I learned through one, like being a person that used drugs that was sort of like in the closet as an EMT and for part of my time as a paramedic was that um, kindness is free. And and it's not like we always think that there's all these things missing from like we need to get like think about the things that we focus on, right? We want to get BUP into EDs and we want to get, like the problem is that if you look at the ED to begin with, the ED is a hostile place towards folks who use drugs. And so we can get BUP in there and we can have naloxone leave out of there. But if we don't change how staff treat people, no one's ever going to come in to use those interventions because the healthcare system is hostile. And being admitted into the hospital when you're someone who uses drugs is incredibly traumatizing. And I always find it funny, like I'm in a lot of these community groups where we talk about let's do an anti-stigma campaign for the community and put up, billboards and like those are all great things, right? But folks are talking from organizations, and I even my own organization, we get here complaints at the syringe program about treatment they receive within the hospital. We haven't fixed how our own institutions treat people. And so the thing that you can do is number one, be nice to people. And number two is that often they don't have an advocate. And so the most powerful thing I ever did as a paramedic was that I would convince the person who was going to take that patient from me that this patient matters to me. This person that I brought in from an overdose or because she's septic from from an injection wound, she matters to me. I'd even make it up sometimes. I'd be like, this is my wife's cousin, and I really, really care about her well-being. And so I want you to take really good care of her. Like I was related to every person who used drugs, like and I was related to nobody in the Berkshires, right? I would convince people that that person mattered to me and that they should matter to you because they matter to me. And to be an advocate and to call people out when they're mistreating people. And not only that, to call them out in front of the person they're mistreating. Because it takes bravery to say to somebody who is either at an equal or higher level than you that I don't like how you're talking to this person. And like you can do that behind closed doors, and that takes bravery too, because of power dynamics. But it'll mean more to the person who's being mistreated if you call out the behavior in the moment that it's happening. I do it to my kids. I see my kids mistreating somebody like at the bus stop or whatever. I'll say, Elijah, the way you're talking to them is not acceptable. You need to apologize, and we're going to talk about it more later. Call it out in the moment that it's happening because it'll be more impactful both for the person who's doing it, but also for the person who's on the receiving end. And look in your own institutions and try to find the barriers that have been put up by systems and figure out who the gatekeepers are who are stopping change and find ways to either work with that person or to like eliminate that barrier. We all, because the healthcare system is the way it is, systems change from the top down is not going to work. And we I learned this a long time ago. Like I from a police perspective, like on a personal level, I'm like an abolitionist, right? But on a pragmatic level, as someone who was a first responder, who was a ranked first responder, I devote a lot of my time to working with individual agencies to change culture at the ground level because I know that if I change one person, they're gonna have an impact on 50, 100, 1,000 people. Like we might not be able to change how systems of care are delivered today, but we can change how individuals treat other individuals. And if enough of that is happening, that does have population level impact.
Well, and I think that's why I'm such a, it's great we were going to have you come talk to our class, and maybe you'll come to our university too, is that this isn't just for any healthcare professionals. I mean, you just explained the golden rule, and whether you're a Christian or whatever religion you are, and I talk about this and lots of other things, to be like, your religion does not tell you not to get vaccinated. Your religion says get vaccinated to protect another person. So if it's that community aspect, right? Your purpose really is the community, and your community is every other human. And I think the only thing, I was going to ask the question, maybe was end with like, what's the regimen to support people in all forms of recovery? And really, it's the spectrum of drug use, recovery, harm reduction, prevention, all of those things. But it's also calling out the good behaviors, right? Would you agree? I'm a parent too, and I do the same thing with kids. Like, do you want to be treated that way? No. Okay. Well, but then as kids and probably even college students and in my classes, they say things like, why do people treat other people this way? And I'm like, well, you learned it.
Right.
And so that's what I really like your message about grassroots change. And, I guess one specific example, and Cassie works in a community pharmacy, is if one person, if the leader says you must treat all people this way, it can be a really good thing. It can be a really bad thing. And it could be a mile down the road, there's the same pharmacy chain, and it'll be a completely different circumstance. That's what I've discovered that across the nation. And so it's really interesting how you can find good folks. And I think it's people, it's this podcast, and it's people with lived experience saying, I'm very happy that you sold me syringes. I don't have HIV because of that. Like, that's a message we've done, to say, go tell the technicians and the pharmacists who are kind of like, why are we dispensing Suboxone? Why are we doing these things? Again, from a pure pharmacy angle, to say, if you just treat everybody great, I'm this white middle-aged guy. I walk into a pharmacy, I ask for naloxone and syringes. I feel that I'm probably treated differently, but I'm not treated like you. It's sort of like, nope, we'll give naloxone to anybody, whatever you want. How do we get it to you? Very helpful.
Yeah, I
And
mean, I buy syringes every time I go to a pharmacy.
yeah, good. Oh, awesome. Good. And they just need to be doing it. And Cassie and I have talked about that too. So, well, we used up a lot of your time. I very
No,
much
that's all right.
appreciate it.
I have one more piece too, because
Oh
we
yeah,
talked
yeah. Please
about
add. Any
journeys.
final
Yeah, and
thoughts?
I have one more piece about this journey aspect too,
Yeah.
is that journeys actually do come to an end at some point. And so for me, 12 years out from like the first day I went into, I'm actually 12 and a half years out from the first time when I went to treatment. Um, I have decided that I'm not in recovery anymore. I'm recovered, or however you want to put it. It doesn't have to be perpetual. If I started using today, it would take it would take time for it to rise itself back up to like something that was problematic, right? And that would be a new journey I'd have to deal with. But the journey that I was on, well, I'm a very different person than I was 12 and a half years ago. I've changed immensely, right? And I've achieved a lot. And I'm not that person anymore. I don't have to identify as someone in recovery for the rest of my life. Like, I'm someone who used drugs. I use drugs now. Favorite drug, caffeine, use it all day, every day, right? Like, so I don't think that we have to just, if that label suits you to use it, like, go ahead. I'm a live and let live kind of guy. Like, do what makes you happy, but you also can allow yourself to let go of these labels as well. Like, and you can just be you. I'm just, when you give my intro, does my intro say that I'm a person in recovery? No, it doesn't. Like, because I don't have to be anymore. I don't want to be. That's not how I define who Stephen Murray is, right? Like, and I may change how I define myself tomorrow, because that's my right to do. Like, so sometimes I think the recovery label and the long-term recovery label, it's almost like society puts that on you. It's like, if you like, I used to be a smoker. I quit smoking 10 years ago. I saw in my medical record like 4 years ago that it said former smoker in my thing. And I literally clicked the remove on it. Not anybody's business. I smoked 10 years ago. Leave me alone. Like, that's not how I don't define myself as a former smoker anymore. I got my own new set of problems to deal with. Like, those are the problems. Like, being a former smoker, like, that is not something that anybody needs to see on my medical record or know about or care about, because it's not at all pertaining to me anymore. So allow people to like shed their labels and be who they are. And yeah, I'll leave it at that.
Thank you. This has been such a great conversation. I'd like to thank our incredible guest, Stephen Murray, for joining us and providing great expertise, insight throughout our discussion today. And thank you so much.
Thanks for having me. Appreciate it.
I'm sure we'll post all your socials. You'll get a form for us to hand out, but we post all our episodes at PharmD Pub Health. That's farm like pharmacist, PHARMD as in doctor, Pub Health. On Instagram, connect with us on LinkedIn. Turn on post notifications so you never miss an episode. Smash that subscribe button now for the Regimen on anywhere you get podcasts, Spotify, Apple Podcasts, YouTube, Amazon Music, anywhere you listen, and follow us on social media for any of those updates. Thank you so much, Stephen. It's been wonderful, and I'm sure we'll be in touch again.